Have you ever noticed that, at the end of the day, your shoes seem to have shrunk or that the impression from your socks is deeply etched into your skin? For many people over 50, swelling in the legs and ankles is not just an aesthetic discomfort, but a persistent sign that the body is struggling to manage internal fluids. Often, we normalize this symptom, thinking it's just an age thing or simply the result of a tiring day. But the truth is that this swelling, known medically as edema, is trying to tell you something important about the functioning of your heart, kidneys, or circulation. In this video, we will deeply investigate the 4 most frequent reasons that cause this swelling specifically in this phase of life. Understanding the root cause is the only way to stop masking the problem and start treating it for real, avoiding serious complications that can limit your mobility in the future. Stay tuned, because one of these reasons could be something you consume every day and have no idea is affecting your legs. Let's start straight with reason number 1, which is responsible for the vast majority of cases. Compromised venous return. The first and most common reason for leg swelling after age 50 is chronic venous insufficiency, which is basically the difficulty veins have in pumping blood back to the heart. Over the years, the valves inside our veins, which should prevent blood from flowing down, begin to weaken and lose efficiency, allowing blood to accumulate in the lower limbs due to gravity. This damming of blood increases pressure inside the vessels, forcing fluid out into the surrounding tissues, which generates that characteristic swelling in the ankles and feet, which usually gets much worse in the heat. In addition to the natural aging of veins, factors like a sedentary lifestyle aggravate this situation because the calf, which acts as our second heart, pumping blood upwards, ends up becoming weak and unused. If you spend a lot of time sitting or standing in the same position, this mechanism fails and fluid accumulates rapidly. It is vital to understand that this does not resolve itself and requires lifestyle changes. But pay attention, because the next reason might be hidden in your medicine cabinet, and you need to know how to identify it. If you want to continue learning to decipher your body's signs to live with more health and autonomy, check now if you are subscribed to the channel and click the like button. This helps YouTube deliver more vital content like this to you and ensures you don't miss any important updates about your health. The side effect of medications, a factor that many people ignore and which is extremely common in the age group over 50, is swelling caused as a side effect of continuous use medications. Certain high blood pressure medications, known as calcium channel blockers, are famous for causing ankle edema as an adverse reaction, even if they are controlling your pressure well. Besides them, some anti-inflammatories, diabetes medications, and even hormones can promote fluid retention, causing you to treat one problem and end up getting this leg discomfort as a bonus. It is fundamental that you never stop taking your medication on your own, but if you notice that the swelling started or worsened right after starting a new treatment, this is an important alert. The doctor needs to know this, as it is often possible to switch medication or adjust the dose to eliminate this effect. Many people spend years treating swelling with stockings and massages without success, when in fact the chemical cause is being ingested daily. Now, we need to talk about a reason that involves your body's filtration and your heart health. The heart and kidney alert. The third frequent reason is a bit more serious and involves your body's ability to pump and filter blood. We are talking about heart or kidney failure. When the heart doesn't have enough strength to pump blood efficiently, fluid tends to accumulate in the lowest parts of the body due to gravity, generating swelling that usually affects both legs equally. Similarly, if the kidneys aren't filtering the blood as they should, excess sodium and water are retained in the body, soaking the tissues. Unlike venous swelling, which can be relieved quite a bit just by elevating the legs, edema caused by heart or kidney problems tends to be more persistent and can be accompanied by other symptoms, such as shortness of breath when lying down or extreme tiredness with minimal effort. This type of swelling, where you press the skin and a dent remains that takes a while to return, pitting edema, requires immediate medical evaluation. But there is a fourth reason, closely linked to the modern lifestyle, that acts silently by retaining water in your body. The enemy in the diet, excess sodium. The fourth reason is fluid retention caused directly by diet, specifically by excessive sodium consumption, something very common in the modern diet and which worsens with age. As we age, our taste buds may lose some sensitivity, leading us to add more salt to food to taste it, without realizing we are overloading the system. Sodium acts like a magnet for water. The more salt you have in your blood, the more water your body holds on to try to dilute this mineral, and this extra water inevitably ends up in your legs. It's not just table salt that is the villain. Processed foods, cured meats like ham and salami, and canned goods are sodium bombs that we consume without realizing the actual amount. Reducing salt and increasing the intake of pure water helps to wash this excess sodium out of the organism, allowing the kidneys to function better and de-bloat the body. Adjusting the diet is one of the fastest ways to see results in mild swelling. However, you need to know how to differentiate when swelling is just retention and when it is a medical emergency. And that is what we will see next. Is this content making sense to you? Then become part of our community by clicking subscribe and turning on the notification bell. Your participation is very important so that I can continue bringing quality medical alerts, totally free, to help you take care of those you love. Leave your like to support our work. When swelling is dangerous, warning signs: there is a crucial difference you need to learn today. Symmetrical swelling in both legs versus asymmetrical swelling in only one leg. If you notice that only one of your legs is suddenly swollen, and this is accompanied by pain, redness, or heat in the area, this could be a sign of deep vein thrombosis, DVT. Thrombosis is the formation of a clot that clogs the vein, preventing blood from passing, and it is a medical emergency that cannot wait to be seen later. Another warning sign is when the swelling rises rapidly above the knee or is accompanied by sudden shortness of breath. In these cases, do not try to do home massages or drink diuretic teas, because if there is a clot, the massage can dislodge it and it can travel to the lung. Self-knowledge saves lives. Look at your legs every day and compare one with the other. Knowing this, let's see now what the practical and safe strategies are to relieve common daily swelling. Immediate relief strategies. For common swelling caused by poor circulation or a tiring day, the golden rule is to counteract gravity. Elevate your legs above heart level for at least 20 minutes, 3 times a day. This facilitates the return of venous blood and lymph, providing almost instant relief from the sensation of heaviness. Additionally, moving your feet by making circles with your ankles while seated helps to activate the calf muscles, pumping stagnant fluid out of the legs. Another powerful strategy is the use of elastic compression stockings, but be careful. They must be prescribed by a doctor to ensure the pressure is adequate for your case, as the wrong stocking can actually worsen circulation. Contrast baths, alternating warm and cold water on the legs, also help to constrict and dilate the vessels, stimulating blood flow. These are palliative measures that help with symptoms, but long-term prevention requires a deeper change in routine. The importance of movement. The muscle pump, the best natural remedy for leg swelling, is strengthening the calf, the leg potato, as it is colloquially known in Brazil. As we already mentioned, it acts as a muscle pump that pushes blood against gravity. Daily walks of 30 minutes are enough to keep this pump active and efficient. If you have movement limitations, simple tiptoe exercises, standing on tiptoes and coming down, can be done even while holding onto a chair or lying in bed. A sedentary lifestyle is the biggest enemy of circulation after age 50. The human body was designed for movement, and when we stop, fluids stagnate. Creating a routine where you don't stay seated for more than an hour straight, getting up to take a short walk around the house or office, is essential to prevent swelling from becoming chronic and evolving into skin problems or ulcers. Moving is lubricating the gears of your circulation. Did you like these practical tips? If you want to receive more guidelines like these to improve your quality of life, don't forget to subscribe to the channel right now. It's fast, free, and can transform your health. Leave a thumbs up if you are going to start practicing walking or leg elevation today. The role of hydration. It seems contradictory, but drinking water helps combat fluid retention. When you drink little water, your body enters survival mode and starts storing every fluid it finds, fearing dehydration, which causes swelling. Staying well hydrated signals to the organism that it can release excess fluids and toxins through urine, cleansing the system and reducing edema in the extremities. The hydration goal varies for each person, but observing the color of your urine is a great thermometer. It should be clear, almost transparent. If it is dark yellow, you need to drink more water. Besides water, natural teas like horsetail or hibiscus have mild diuretic properties that can help. But always talk to your doctor before introducing any herbal remedy, especially if you already take prescription medications, to avoid unwanted interactions. Swelling in the legs after age 50 is a common symptom, but it should never be ignored. Whether due to venous insufficiency, medication effects, systemic problems, or excess salt, your body is asking for help. Identifying the exact cause with the help of an angiologist or cardiologist is the first step to solving the problem and not just masking the symptom. Remember that taking care of your legs is taking care of your independence to come and go. Start applying the changes today. Reduce salt, move more, drink water, and observe the warning signs we discussed. Your vascular health will thank you, and you will feel the difference in the lightness of your daily life. Do not accept pain and heaviness as normal companions of aging. There is treatment and there is relief. Take care of yourself with affection and attention. If this video helped you better understand what happens to your body, please subscribe to the channel and turn on notifications so you don't miss our next meeting. Share this video with your friends and family who also complain about leg swelling. This information could be the alert they needed. A big hug, God bless, and see you in the next video.